When I see a patient, the first thing I want to do is try to establish a good rapport with them, because this is a physician-patient relationship that is potentially going to be long-lasting. I try to get them to buy into the whole approach in the program so that they have a say and a decision into what their care is. I want them to understand what their problem is, so I try to describe it and explain it in simple ways so that they know what their issue is, so they know how to make the right decision when deciding when to have surgery or when to do non-operative or conservative management. If they decide that they're going to have a surgery, I want them to understand, well, what is the downtime? What is the recovery like? What are the expectations that I would have and that they would have so that they can get a successful result? And then long term, I like to follow the patients, especially if they have a shoulder replacement. I follow them yearly. I tell them until the end of their life or the end of mine, so that we can see each other and make sure that we monitor and everything turns out okay. I think the biggest thing that I enjoy is really the ability to help somebody. Most of the people that I see have significant limitations and pain, and they're dealing with it for a long period of time. And I'm able to offer them something that can get them out of pain and improve their function and their quality of life. And that's really what it is trying to improve the quality of life of the patient.